Welcome to our virtual event, 11 Ingredients of a Safety and Health Program. Thank you for joining us. My name is Jeff Shaw. My background with education and experience is in agriculture and chemical manufacturing. I am a certified health and safety consultant and work as a prevention consultant with Safe Work Manitoba. Safe Work Manitoba is a division of the Workers' Compensation Board of Manitoba and the public agency dedicated to the prevention of workplace injury and illness. Working with our safety partners in the safety community, we provide prevention education, safety programming, consulting, and strategic direction to create a genuine culture of safety for all Manitobans. So before we get going, I'd like to go over a few housekeeping items. This presentation has been pre-recorded to ensure we are able to deliver clear information. So some of the information may have changed since we recorded the session. Please use the Q&A panel if you have any questions or experience technical issues during the presentation. We will do our best to respond throughout. If we are unable to give an accurate response right away, following this presentation, we will compile all questions and post responses on our website. The recording of this presentation will be posted at a later date on the Safe Work Manitoba YouTube channel. So this webinar is about 45 minutes long and covers the following topics. Over the next few slides, I'll answer some frequently asked questions about safety and health programs, such as what exactly is a safety and health program? And what are the benefits of having a program? And when do we need it? And then I'm going to introduce you to the 11 ingredients of the safety and health program and ending the session with a Q&A. So let's dig right into it. Some of you might be new to this topic and asking yourself right now, what exactly is a safety and health program? Well, a safety and health program is a plan of action designed to prevent injury and illness at work. That's what it is. Essentially, it can be a very effective tool a workplace can implement to mitigate risk and reduce injury and illness within their workplace. And here's another really good question. Are the requirements for establishing a workplace safety and health program legislated? And yes, the requirements are legislated. And you can find this under section 7.4, subsection 1 to 7.4, subsection 8 of the Manitoba Workplace Safety and Health Act. And just another quick note on legislation. This legislation hasn't been in place for several years. In saying that, amendments are made from time to time. So for example, back in 2013, there was an amendment put in place that set a procedure for reviewing and revising the workplace safety and health program had to be established to ensure the program gets reviewed every 3 years or more often if circumstances at a workplace change. So it's always important to stay informed and have the most recent copy of legislation to keep your program current. Which brings us to another question. According to legislation, when is a workplace required to have a safety and health program? Legislation requires employers to establish a written safety and health program for each workplace where 20 or more workers of that employer are regularly employed. In saying that, though, that's just the minimum requirement. So nothing stops any business with less than 20 workers to establish a program. So maybe you're a growing business that will hit 20 workers in the near future. By establishing a safety and health program now, you will be ready when you hit 20 workers and be already benefiting from having a program in place. And who is responsible for creating and maintaining a safety and health program? You got it. Ultimately, the employer must establish the safety and health program, but a well-functioning program requires buy-in from all levels of an organization. The program must be developed in consultation with workers, and everyone from senior management to workers must be accountable for carrying out their responsibilities. So like I mentioned last slide, the program also needs to be current as things change and evolve over time. Regular review of the program is legislated, and workers, supervisors, committee members, safety reps, employers will be all involved with this to ensure it remains current. Which brings us to the question, and is one that is often asked, especially by new employers, is what are the benefits of having a safety and health program in place? When you have an established safety and health program where everyone knows the importance and working together towards a common goal, you're going to see benefits. So you will see a reduction in injury rate, which results in lower injury costs and ultimately lower WCB premiums. When workers feel safe, they feel cared for, they feel valued, there will be enhanced employee morale. And when workers feel this way, it usually means increased productivity. So that's just some of the benefits. So it just makes good sense to have a good safety and health program in place. Before digging into the elements of a safety and health program, I want to provide a really quick analogy. You may not know this, but I really enjoy cooking. And when I think about building and piecing together a safety and health program, I think it's very similar to baking a cake. So let me explain. When you bake a cake, you have a number of different ingredients that play an essential role in ensuring the cake turns out like it's supposed to. Each and every ingredient is critical to ensure the cake is a success. As you can see from the picture on the slide here, you have eggs, you have flour, you have baking powder, margarine, sugar, etc. But one ingredient can't make the cake on its own. Many ingredients get mixed and stirred together in order for the recipe to work. And this to me is very similar to a safety and health program and its elements. Maybe we really like this cake and use the same recipe over and over and over again. But at times, maybe we run into a few hiccups. Perhaps we were multitasking in the kitchen today, got distracted and put too much or too little of an ingredient into the recipe. Or a certain ingredient was not available and we had to substitute it for something else. Maybe there's a new chef in the kitchen, or maybe a new appliance in the kitchen that has interrupted the process and resulted in the cake not turning out like it's supposed to. At this point, we need to dig into things, assess, and take some corrective actions so we don't run into that same situation again. So without further delay, let's bake a cake safety and health style today. So today I want to take you through a safety and health program and its ingredients, or better known as its elements. Although each one is clearly identified on the upcoming slides, you'll quickly see they all intertwine and mix together with one another. Each element needs to work with one another for the program to work, just like the cake analogy. While these ingredients should be part of every workplace's safety and health program, workplaces need to tailor the program to be workplace specific. The other really important item to mention here is the safety and health program with its elements needs to be readily accessible for all workers in the workplace. So it's made to be used, right? It's not made to collect dust on a shelf somewhere. It's also the minimum requirement. So a lot of businesses and industries go above and beyond if they have gaps or need to implement more elements for their line of work. But for today, we're going to tackle these 11 elements. So just a really quick heads up, guys, this is a very quick 2-minute overview of each element just to get you a little bit familiar with each element. And just as a quick note, for more detail on any elements and information we are talking here today, please reference the Guide for Developing a Workplace Safety and Health Program found on the Safe Work Manitoba website. For more info on specific legislation, please refer to the Manitoba Workplace Safety and Health Act and Regulation. All right, let's get going. All right, so let's jump right into the elements of a safety and health program. And the first one is the safety and health policy. The safety and health policy really sets the tone for the safety and health program. The policy essentially is a formal statement outlining the employer's commitment to safety and health in the workplace. It sends a clear and direct message to all workers in the workplace that management is committed to their safety and health and expected to be implemented on a daily basis. The policy should be created in consultation with the committee or the safety and health representative and should set out overall objectives and include general principles or philosophies. The policy itself should be signed by senior management. It needs to be current and posted in a location for all to see. Most importantly, the policy needs to be communicated to workers and put into action. So spend some time on this one, review it regularly with workers and the Safety and Health Committee, and follow through on those commitments. It's an awesome way to set the tone for your safety and health program. All right, so let's add some sugar into this recipe as we move on to ingredient number 2, which is called identifying and controlling hazards. And there's a lot of moving parts with this one. and it's really critical that all parties in the workplace are involved and understand the importance of this element. To help explain and understand some of the high points of this one, let's work through the SAFE acronym, the SAFE. So starting with the S, which stands for spot the hazard. First and foremost, employers, supervisors, workers, contractors, suppliers need to be trained on what hazards are so they are able to spot them in their workplace and work areas. And there are various hazards depending on your workplace. And remember, not all hazards are visible or things that we often think about. Slips, trips, falls, chemicals, moving equipment, crush points are all often things we see and understand. But what about those hazards that are invisible, for example? Things like musculoskeletal injuries, noise, vibration, psychosocial hazards, viruses, molds. We don't want any of these hazards to fall through the cracks that could result in injury or illness. So everyone in the workplace needs to be trained on what hazards exist so they can identify and be part of the process of making things safer. Speaking of spotting hazards, how do we find them in our workplaces? So the most obvious one you're likely thinking about right now is inspections, but hazards can also be identified through reporting, by doing job hazard analysis, and also investigations. Moving on to A, which is assess the risk. Once these hazards are spotted, what exactly do we do with them? At this point, we need to assess the risk of injury or illness associated with that hazard by considering the severity of consequence, probability, and frequency, and determine how we will address the risk. Once the risk has been assessed, we move on to F, finding a safer way. This process involves finding a safer way to eliminate or reduce the risk of the hazard utilizing the hierarchy of controls. Ideally, the best way to control a hazard is to eliminate it altogether. But if this is not possible, we try to remove or control the hazard at the source, along the path, and at the worker level. So controls such as automation, substitution, isolation, redesign, additional guarding, there can be dilution, you might have policies, your procedures, your housekeeping, your personal protective equipment, training. All of these are examples of how risk may be mitigated by implementing the hierarchy of controls. Moving on to E, which is every day, which means we are making this part of how we conduct work on a daily basis. So basically working through the SAFE acronym each and every day in your workplace. Time's up on this one. We're moving on to the next element. Ingredient 3, dealing with emergencies. Imagine yourself or someone on a work site who's been injured. You're in pain and nobody has a clue what to do or who to call. Maybe it's in a rural area somewhere where emergency services is going to take a long time to respond. While waiting for emergency services, nobody knows how to assist or has the resources or training to help support until emergency services arrive. For those who have ever been involved with an experience like this, they often say it feels like a lifetime before anybody shows up. Emergencies happen, and we need to try to be prepared as much as we can for any situation. Unfortunately, some of the most tragic workplace injuries and fatalities have occurred because workplaces simply were not prepared for them. Benjamin Franklin had a quote that really emphasizes this. By failing to prepare, you are preparing to fail. So here are a few helpful tips for you to start thinking about this element. And again, think about that SAFE acronym. Brainstorm and create an inventory of all emergencies that could happen in your workplace and think outside the box a little bit as you're doing this, as not all emergencies are obvious. So I think about things like responding to allergies, neighboring businesses, emergencies that may affect your business. It could be violent situations. It could be weather events, offsite locations, etc. Then start planning for these events. This can mean identifying primary and secondary evacuation routes. It's your emergency exits, your muster points, having fire wardens in place, alarm systems, your maps, your first aid kits, first aiders, fire extinguishers, chemical spill kits, personal protective equipment, and the list goes on. I simply can't emphasize this one enough is practice, practice, practice. Train all workers and staff on emergency hazards and procedures. They really need to fully understand what their roles and responsibilities are in these situations. Things like what numbers to call, how to use a fire extinguisher, performing CPR, and describing location of an incident, just to name a few. And practice. Conduct drills on a regular basis, set up mock emergencies with different scenarios. Once you have conducted these drills, identify gaps, improve, and communicate corrective actions to everyone in the workplace. Review your emergency response plan regularly. Being prepared could save your life and others. Let's add some baking powder to this recipe, which is ingredient 4, called roles and responsibilities, and personally one of my favorite ones. For a program to be effective, everyone in the workplace needs to know and understand they have a really important role to play. And this is sometimes missed in a lot of workplaces, and quite honestly, where some programs can go off the rails sometimes because nobody understands their safety and health responsibilities. Clearly defined responsibilities with accountability and authority provisions in place will help create a strong internal responsibility system. So you might be asking yourself, what exactly is an internal responsibility system? Basically, in simple terminology, means that everyone in the workplace has a duty to work together to ensure all workers go home safe at the end of the day. So whether you're an employer, a supervisor, worker, contractor, supplier, a board member, an owner, please know and understand your legal responsibilities. So let's go through a couple of examples. So if you are an employer, one of your responsibilities is to provide and maintain a safe workplace, including equipment, tools, and systems. If you're a supervisor, one of your responsibilities is to ensure workers comply with safe work procedures and use safety equipment, clothing, and devices. And an example of a worker responsibility is to ensure proper use of safety equipment, clothing, and devices. By having these roles and responsibilities clearly outlined and incorporated into job descriptions and documented in the program will help ensure things run smoothly. For more information on legislated responsibilities, please reference the Workplace Safety and Health Act. So to summarize this one, if everyone knows their roles and responsibilities, follows through on them, and they look out for one another, there is no question your workplace will be safer and healthier. All right, so let's drizzle some inspections into this recipe. Inspections are a crucial component of a safety and health program, and it provides opportunity to identify hazards on an ongoing basis. Inspections not only identify what hazards are present, but also tells us what risks those hazards pose, what controls should be in place, are those controls working, and are any improvements needed? So there are a number of different inspections that can occur in a workplace, including informal inspections, formal workplace inspections, and formal committee inspections. Informal inspections are not scheduled and for the most part are spontaneous. This means continually checking your work area for hazards and checking out the area before performing a task. Formal workplace inspections are scheduled and often tailored to the work, task, or equipment being inspected. These inspections are documented and frequency will depend on level of risk, manufacturer requirements, and your safety and health program expectations. It's important that all workers taking part in workplace inspections are trained and know how to conduct an inspection. For example, one of the duties of a safety and health committee is conducting inspections of the entire workplace at least once every 90 days. So all committee members should be trained, involved, and looking for trends or patterns, determining whether more action is required in certain areas. A formal inspection program must be part of the safety and health program, and answers to these type of important questions on the next slide must be considered when developing your inspection element within the program. So here's some example of some questions. So things like, who will inspect? Are committee members involved? When will it be done and how often? What needs to be inspected? Are regular and special inspections conducted? Are inspectors looking for hazardous acts and conditions? If you find something unsafe, who gets this information? What needs to be corrected? And who follows up on those corrective actions? How is this going to be communicated to the rest of the workplace? And are all inspection forms being documented? So I encourage you all to keep spotting those hazards in your workplace and take action. We touched on some of this information already when we tackled element 2, identifying and controlling hazards, but let's dig into these two types of hazards even a little bit further, which is ingredient 6, chemical and biological hazards. Let's face the facts. Each and every day, we are all exposed or work with chemical and biological substances that potentially could cause risk to our health. Workplaces are always changing, so it's always good practice to assess work regularly for these hazards. Workers need to know and understand the substances that they are handling, what risks they pose, how to protect themselves from that hazard, and what needs to be done if an emergency happens. Within the program, systems need to be established to ensure controls are in place to protect workers from these hazards, and all personnel in the workplace will have very specific roles and responsibilities in regards to chemical and biological hazards. When discussing chemical safety, I'm sure most of you are familiar with WHMIS, which stands for Workplace Hazardous Materials Information System. WHMIS establishes requirements for working with controlled substances with the common goal of ensuring workers have the information they need to work safely with these products. Within the safety and health program, there will also be chemical safe work procedures, emergency planning around chemicals, and PPE requirements to deal with these chemical hazards. Shifting over to biological hazards for a moment, and this is an area where some places kind of forget about these from time to time. When we start thinking about these, every workplace has biological hazards. Blood, bodily fluids, bacteria, viruses, insects that carry disease, such as mosquitoes carry West Nile. We also have hantavirus in mice. So these are just naming a few. The safety and health program is required to address the risk of these hazards and implement controls to protect workers. And remember, exposure from chemical or biological hazards can have acute and chronic effects. So exposing yourself to a chemical or biological substance can potentially cause major consequences 15, 20, 30, 40 years down the road. So your action or inaction today really matters. So when spotting hazards in your workplace, don't forget about chemical and biological hazards. If you haven't done so already, create a control plan for these hazards. So let's mix some margarine into this recipe. Ingredient 7, which is called contractors. So a lot of workplaces out there use contracted employers or self-employed persons. There are also workplaces that serve and have public on their premises on a daily basis as well. So the last thing a workplace really wants is to have an external worker or a member of the public get hurt or injured on their job site. Injury prevention applies to all workers and includes the public. So controls and systems need to be in place to ensure all people affected will be protected. Procedures must be developed and implemented for evaluating contractors and self-employed persons. And again, everyone in the workplace will have responsibilities when contractors or members of the public are on site. So whether you're a contractor, the owner, a supplier, supervisor, worker, we will all have a role to play. These again need to be clearly laid out and documented within the safety and health program. So questions to ask yourself. Are there criteria in place for evaluating the safety and health of contractors? Are they aware of your safety and health expectations? Is there a system to monitor the contractors while they're in your workplace? Do you have a system in place to recognize when a contractor is needed in your workplace? And quite simply, do you know what your role is? So that really gives us a quick snapshot on contractors. And now we're going to move on to ingredient number 8, which is called training. Eggs are a really essential ingredient, and so is training when it comes to the program. Training is really a crucial component of a safety and health program, and formal training plan needs to be established. To help reduce risk of injury or illness, workers need to really understand the hazards that they are working with and how to protect themselves from those hazards. When workers know this information and confident in the task they will be performing, there will be less chance of them getting injured or having an illness. And remember, training is required for all workers, including supervisors, safety and health representatives, and safety and health committee members. Providing new workers with a solid orientation gets the ball rolling, and from there, moving into various training needs, including task-specific training. So if you're wanting some more details on this and what needs to be included in your safety and health training and your orientation, please refer to Safe Work Manitoba's new work training guide. So I don't have time to go into a lot of detail with this one, but your training program should also include various learning styles, such as using videos. You have some reading, some e-learning, demonstration, you have some group discussions to ensure workers are retaining and understanding that material. When checking for understanding, it's also vital to consider language and literacy issues as well. So we all learn a little bit differently, therefore incorporating as many styles as possible is really important. As the slogan states, safe workers aren't born, they are trained. So moving on to ingredient 9, investigations. So conducting investigations in your workplace is such an important element, and there are many different kinds of investigations that can occur within a workplace. There's investigation of near misses, incidents, right to refuse occurrences, to help ensure those same occurrences cannot happen again. The last thing a workplace really wants to deal with is someone else getting hurt in the same situation. And that is why it's so important that investigations take place. So the whole idea behind conducting an investigation is to find out why the incident or near miss incident occurred in the first place. Investigations are not a fault finding mission. Rather, it's all about fact finding. Once the direct, indirect, and root cause or causes are known, controls can be established and communicated to help mitigate the risk of that same thing occurring again. Without a proper investigation, though, those hazards are still lingering and they're just waiting for that next person. So when it comes to investigations, there are several steps involved with this, and they need to be clearly laid out within a policy or procedure. So depending on the type of investigation, different people within the workplace will be involved. So for example, legislation states that one of the duties of safety and health committee members is to participate in the investigation of accidents and dangerous occurrences in the workplace. Those involved need to be adequately trained on how to perform and work through the investigation process. There is also the requirement under Manitoba Workplace Safety and Health Act and Regs to report serious incidents to Workplace Safety and Health Branch. Whether or not Workplace Safety and Health Branch conducts an investigation into the incident, the workplace itself also needs to conduct its own investigation. All right, we're getting there, everyone. Hang in there. We haven't added any flour yet, which is arguably the most important ingredient when baking a cake. Personally, I feel participation in a safety and health program is very similar. Quite simply, for a program to work and to be effective, there must be a procedure for worker participation, and everyone in the workplace really needs to participate. If a program doesn't have participation, it's going to show pretty quickly. And remember, the right to participate is one of the 4 rights in Manitoba. If you're new to this, you might be asking yourself right now, you might be saying, Jeff, how does one participate in the safety and health program? Well, there are several ways that workers can participate in the safety and health program, such as being elected to the safety and health committee or safety and health representative, taking part in job hazard analysis and safe work procedure creation, attending toolbox talks and regular safety meetings, taking part in training, reporting hazards, offering suggestions, and using your voice if you have a concern. Employers and supervisors really need to encourage workers to use their voice and take part in these activities. When a concern is raised by a worker, processes need to be in place to address the concern and to come up with a solution. Safety and health committees and safety and health representatives should also find ways to promote participation in the safety and health program. Also, brainstorm ways to celebrate accomplishments and achievements. There's various ways of doing this, but a couple that come to mind is participating in Safety and Health Week. Maybe you might consider having staff and family barbecues. Maybe you have some incentive draws, right? There's different ways to do this. If everyone in the workplace is participating and working towards the common goal of making the workplace safer and healthier, the internal responsibility system and the program will strengthen, resulting in less injury and illness. Employers need everyone in the workplace to have buy-in, take safety into their own hands, and to be part of the safety and health program. Workplaces are dynamic. Things change constantly, so updates and regular reviews of the program need to occur to reflect these changes. So I know you might be thinking right now, what really changes within my workplace? But when we stop and think about it, a lot can change, right? So when you think about it, the work itself can change, worksite locations can change, expansions occur, people can change, things like equipment, tools, and products too. So the list goes on. This is why it's important to evaluate the program at regular intervals and at a minimum every 3 years. Things like job hazard analysis and safe work procedures and inspection templates. Additional training will be required along with additional control measures that will need to be implemented, just to name a few. So by having a formal system in place to review the program, it provides opportunity for the workplace to evaluate current strategies, look at some stats, compare some stats. You're going to look for some patterns and identify strengths and opportunities where you can improve. So you might look at things like, are injuries and illnesses decreasing? Are there trends in near miss and incident reporting? Are regular inspections taking place? Is the committee fulfilling its duties? Are safe work procedures being followed? These are all important questions, and regular review will help determine if any gaps exist and where some improvements might be needed. And document. Record keeping is a very crucial component of the safety and health program, including the evaluation of documentation. So you want to keep copies of all safety records, your training, your inspections, investigations, committee minutes, job hazard analysis, etc. So having a good record keeping systems allow workplaces to evaluate overall safety performance, and it also provides proof of due diligence. We did it. There is our safety and health cake. All of those ingredients make an effective safety and health cake or program. So just to go back to the cake analogy for a moment, things can change in the workplace, or maybe we spent a lot of time on one element and forgot about another, and it has caused some issues. Maybe when you started cooking, nobody really cared for the taste of your cake. They took a few bites, but you could tell that they didn't really like it. And I know myself, I have experienced that. But you stuck with it, you reached out for support and asked others how the recipe could be improved. You assessed and implemented those changes. And over time, the cake kept on getting better and better. And soon everybody started to say how delicious your cake was and asked for more and more every opportunity that they got. So a cake recipe with its ingredients is very similar to the safety and health program and its elements. In order to have success, those baking the cake need to know the cake recipe and how important each ingredient is. But you know what? It isn't always easy, right? It doesn't come easy sometimes. So we need to practice, train, experiment, ask for help and guidance, get buy-in, and it's not always a fast process, but it can be done. So just like baking a cake, there will always be changes and challenges that come up. But if you can establish the recipe, which is the program, and understand how the ingredients and the elements mix with one another to make a great cake, you'll have that strong foundation. So when those issues arise, you can always reassess and revert back to that recipe. So here are some key points and takeaways from today's webinar. As learned, there's a lot of history with program and remains an important tool in any workplace to mitigate risk of injury and illness. For the program to be effective, everyone has to understand they have an important role to play. So all parties in the workplace need to know and understand their roles and responsibilities and follow through on them. Regardless the size of your workplace, the 11 elements will help ensure an effective injury prevention system is in place. As mentioned, workplaces are dynamic. Things change on a regular basis. So the program needs to reflect or keep up with these changes. So think of it as a living document. And like I said earlier, the program is developed to be used, right? And not to sit on a shelf somewhere and collect dust. Ever so important, the program needs to be readily available to all workers in the workplace. And no matter the maturity of your program, there's help and support out there. So whether you're starting it from scratch or wanting to improve what you already have in place, there are a number of organizations that can provide support, including Safe Work Manitoba and industry-based safety programs. All right, so that concludes the information of the webinar, but we're now going to move into a Q&A session. So the first question is, I'm an employer who employs less than 20 workers. Does this legislation around safety and health program apply to small business as well? Very good question. And sometimes this has caused some confusion when legislation states an employer is to establish a program when 20 or more workers are regularly employed in the workplace. And those workplaces under 20 workers sometimes think this doesn't apply to them. If you're less than 20 workers, the legislation still applies. So legislation it doesn't say you need to have an actual formal program, but the Workplace Safety and Health Act and regulations still applies to that business. So yes, the legislation applies. So call it what you want. You can call it a program, you can call it systems, etc., but you must have these requirements in place. So for example, we talked about emergency plans, safe work procedures, training, investigations, etc. All of these pertain to workplaces with less than 20 workers. So as I said before, if you're under 20 workers, you might as well create a safety and health program as the majority of the legislation still applies. So we do have another question here. It talks about training. So under the training element, when should training be provided? Again, another great question. So when it comes right down to it, it's important that workers are competent in the tasks they will be performing and why training is so critical. If workers don't get the adequate training and they're not competent in their tasks, that's where they will be at risk of injury and illness. So the Manitoba Workplace Safety and Health Act specifically identifies when workers need to be trained. So it speaks to they need to be trained when workers start a new job, when being reassigned to a new work area, when new equipment and tools are being introduced, would be another one, and when safe work procedures change. So those are the four main areas that the Act provides that clarification. Got one more here. I think we have time for one more. So my question is, how can I make sure my safety and health program is accessible and frequently used? Yeah, and this can be a challenge for some, right? So yes, as I've emphasized, the safety and health program really needs to be used. It needs to be accessible. It needs to be readily available. If a lot of the documentation is in a binder, that binder or binders needs to be located in an accessible location. If parts of the program is on the company intranet, then again, all workers need to have access to that. Some components of the program can be visually displayed. For example, safe work procedures. You can have them posted somewhere. So for example, if you're using a certain piece of equipment and you want a quick reference for it, that safe work procedure can be posted on a piece of equipment. Safety data sheets can be located where chemicals are being stored or used. Pre-inspection forms can be housed on power mobile equipment. Policies, procedures can be posted on the safety and health bulletin board. So there's different ways that these things can be accessible to the workers so they can have that quick reference. So the program and its elements are created to be used and referenced. It needs to be easily accessible. And if that's the case, workers are more apt to actually use it. So that concludes our presentation on the 11 ingredients of an effective safety and health program. If you have any additional questions, please do not hesitate to connect with myself. So here is my email on the screen, jjshaw@safeworkmanitoba.ca. And on behalf of Safe Work Manitoba, thank you for watching our virtual presentation. We hope you are able to take away some tools and knowledge to better understand how to develop a safety and health program. We also hope you're able to take away some practical tips as well. So in the coming days, you will receive an email with a link to a list of resources and a survey. You'll also be able to view the complete recording of this webinar and share it with your colleagues. Please be sure to visit safemanitoba.com to view resources and information on developing a workplace safety and health program. Thank you.